Mrs. Sophia Richard has been hospitalized in the medical ward for stage 4 breast cancer, and her doctor has prescribed 2 milligrams of morphine every 3 hours. To avoid repetitive injections, the nurse needs to prepare the subcutaneous winged infusion set to administer regular doses of the opioid pain medication to the user. Prior to installing a subcutaneous winged infusion set in intermittent mode, the nurse needs to prime the tubing to avoid injecting air into subcutaneous tissues. Thus, the medication will be used to prime the tubing and ensure the user receives the exact dose prescribed. To do so, the nurse prepares the medication in a syringe before priming. For the purposes of this video presentation, the medication must be drawn from a glass vial. At the medication cart, the nurse checks the medical order and the user's MAR as well, in order to make sure the medication is prepared in compliance with the 7 rights of use. When preparing an injection, the nurse writes the following information on a label: the user's name, room number, name of the medication, dose prepared, the date and administration time, and finally initials it. Will then be affixed on the needle cap to prevent the occurrence of errors during medication administration. The narcotics drawer remains locked at all times. The nurse uses her pin to unlock it and takes out a 10 milligram per milliliter vial of morphine. She then verifies how many vials are left in the drawer and in the presence of another nurse, and records that number in the narcotics inventory logbook in order to comply with the narcotics control regulations in force. The nurse makes sure the medication is crystal clear and particle-free. She must also check the expiry date, since expired medication can be chemically unstable and therefore must not be administered. The medical order in the user's record indicates that the dose is 5 milligrams. Hence, the nurse calculates the dose to be administered, which is 0.5 milliliters in this case. When preparing medication supplied in a vial, the nurse must use a filter needle to prevent glass particles that could be present in the medication from being injected into the patient. Throughout the preparation phase, the nurse must respect the 7 rights of use, which means the right medication, the right time, the right dose, the right user, the right administration route, the right recording on the user's drug administration sheet or medical file. The nurse then puts the material on a sterile gauze pad to ensure sterility throughout the procedure. Using a quick circular motion, the nurse rubs the vial on a solid surface in order to make its content move down to the inferior part of the vial. Doing this allows the entirety of the solution to place itself in the inferior part of the vial and reduce any unnecessary waste. Another technique can also be used to achieve this. It consists in flicking the side of the vial until its content has moved down to its inferior part. The nurse uses an alcohol swab to disinfect during 15 seconds the neck of the vial and then lets it dry completely. This is done to keep soiling from penetrating into the vial while opening it. Using her dominant hand, the nurse breaks off the collar of the vial. To do so, she places a gauze over its collar and neck. The gauze protects the nurse's fingers against glass particles and also keeps them from scattering towards others. She lightly tilts it from side to side before breaking off the superior part of the vial, which she does by pulling the upper part of the neck towards herself. A vial opener can also be used to do this. The nurse places the vial on a flat surface. She picks up the syringe with her dominant hand, removes the needle cap and places it on a gauze pad. She then uses her non-dominant hand to pick up the vial, holding it between her thumb and index and middle fingers, and then gently turns it upside down. To draw the medication, the nurse inserts the needle in the center of the vial, making sure it does not touch its sides in order to prevent any sort of contamination. She must also make sure the needle bevel remains submerged in the liquid throughout the drawing process to prevent the occurrence of air bubbles. To prime the infusion set tubing, the nurse must draw 0.4 milliliters more of medication than the quantity prescribed, which corresponds to the internal volume of the set. An additional 0.1 milliliter must also be drawn to prime the needle. Once the medication has been drawn, the nurse withdraws the needle from the vial. She then removes the filter needle and replaces it with an injection needle. The nurse points the needle upwards and flicks the syringe to make sure air bubbles move up the needle shaft. It is important for the nurse to pull the plunger before priming has been completed, since flicking will make the medication run back up the needle, which in such a case could reduce the dosage to be injected. Priming can be achieved once a large drop of medication can be seen on the tip of the bevel. The cap is then placed back on the needle to maintain sterility. She affixes an identification label on the needle cap to prevent the occurrence of errors during medication administration. The nurse removes the infusion set from its pack. She holds it by the wings, turns the white preparation cap to take it off, and makes sure the bevel is facing upwards. She then unwraps the neutral displacement valve and inserts it onto the infusion set where the safety cap has been removed. Next, she shuts off the sliding clamp to prime the Y connector of the infusion set. The material will be put down on a sterile gauze pad to ensure its sterility at all times. The nurse uses an alcohol swab to disinfect the neutral displacement valve and then lets it dry completely. In the following steps, she removes the needle from the syringe containing the medication and puts it down on the sterile gauze pad. She places the neutral displacement valve onto the syringe and primes the Y connector. She then releases the sliding clamp and slowly injects the medication to complete the tube priming. To insert the needle back onto the syringe in a sterile and safe way, the nurse places the bottom of her palms together to ensure full stability and prevent any type of material contamination whatsoever. When checking the accuracy of the dose prepared, if the syringe contains more liquid than that prescribed, the nurse expulses the surplus on a dry gauze pad by holding the bevel downwards to keep the medication from running on the needle. She checks dose accuracy once again by holding the syringe at eye level. This way, she is sure the user receives the exact dose prescribed. A second nurse uses the medical order to counter-check the cross-multiplication made to calculate the right amount of sedative. She also validates the dose that has been prepared. The independent double verification rule is mandatory in cases of certain types of medication that are rated as being potentially dangerous. The nurse in charge then fills out the narcotics inventory logbook, making sure the second nurse double-checks and signs it as well. To fully comply with the narcotics control regulations, the remaining medication and the vial have to be discarded in a biohazard container to prevent injuries. The entire process has to be done before another nurse who will countersign the narcotics inventory logbook in order to verify that the unused part of the medication has indeed been discarded. After, the nurse places the material required for the installation of the infusion set on a tray. This includes the infusion set, the syringe containing the medication, alcohol swabs, a transparent film dressing, and a pair of non-sterile gloves, and then heads to the user's bedside to administer the medication.